Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp us on 922681060. My dear friend, this is the series that Dr. Deshpande is trying to explain what type of the different patients come to us and how the doctor should do the management, especially before how she should think about the diagnosis by history taking, by examination, and by doing some investigations. So my dear friends, this is a training or sort of suggestions to the general medical practice or the doctor, GP doctor, and also it's a very useful information for the common man or the patients as well. So today's patient is having the 47-year-old male patient. 47, 40 plus patient, male patient is there. He come and he say, doctor, I am passing this urine very frequently and get severe burning sensation while passing the urine since last 3 days. Try to understand what are the complaints of the patient. He has to go to the toilet very frequently, every after 1 and 2 hours. When he go to the toilet and trying to pass the urine, there is a severe burning. And this complaint is only for last 3 days at the moment. But then what the doctor should try to think about? The first immediate, what you can say, the click in my mind, that burning micturition is there, frequency is there, so it must be related with urinary tract. And urinary tract infection, UTI, is the most probable thing with this patient. But I have to also check, or I have to also think whether there is a bladder, urinary bladder stone or the calculus, or is this problem because the patient is 40 up above 40 years. So it can be the problem of prostate gland, which is present in the male and which is usually enlarged after the age of 40 years, which is called as a BPH, benign prostatic hypertrophy. This is very common, benign prostatic hypertrophy. Okay, so let us start how we can investigate, how we can diagnose. My first question to the patient, my dear friend, do you have the fever with chill? I understand you have the urinary problem, but do you have the fever? Yes, 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 doctor. Just now I had a little bit better, but many times I have a little bit very severe type of the rigors, and then I started to get the fever, high fever. I have examined at my home, and doctor, it is nearly about 101 degrees, but it is with rigor, doctor. Oh, fever with rigor. Please note down, fever with rigor indicates two important diseases. Fever with rigor, two important diseases. One is urinary tract infection and second is malaria. First, urinary tract, because this patient having urinary problems. So naturally, fever with rigor is a supportive evidence, supportive symptom to diagnose my UTI, urinary tract infection. Next, I asked him whether is there your urine stream while you passing the urine, it is a urine stream is a good, or do you have to make any force to pass the urine, to start the urine, or is it your flow is a drop by drop, you pass the urine drop by drop? No, no, doctor, I think I feel that stream is little bit okay. There is no, I do not have to force to take out the urine. So you try to understand. The patient is saying that he need not to force while passing the urine. So naturally, it is unlikely that the patient is having stone, because stone is obstruction. He might not have the prostate problem, because prostate or the stone can cause obstruction and the patient has to force to take out the urine. So this patient has less likely the problem of stone or the problem of prostate enlargement. Okay. Now, tell me, my dear friends, do you get the severe pain at the end of micturition? Yes, yes, doctor, you are true. While I finish my urine, I get a solid burning. Yes, then it can be cystitis or it can be the bladder stone. But of course, bladder stone may not cause the fever. So this patient is having fever, so it is more over to the cystitis and not the bladder stone. Bladder stone will not cause the fever. Now, tell me whether you have any purulent discharge from the urethra, like a pus. Pus is coming from the urethra. No, absolutely not. Absolutely not, doctor. Yes, then in my mind, I relieved. This patient is not having gonococcal infection. STD, sexually transmitted diseases, venereal diseases. One of the diseases is gonococci, and that gonococcal infection always give the fever and also burning and also purulent discharge from the urethra. Okay. Then I ask the patient to lie down and I try to palpate. The doctor should palpate the suprapubic region for the bladder, above the pubic bone, suprapubic bone for the bladder. If I have to check whether the bladder is distended, then it is a retention with overflow. If the bladder is full, then it is a probability that the patient is having a little bit retention. Distended bladder is indicating retention. But of course, this patient don't have that much type of the retention. Then I will check the genitals also. I can retract the prepuce and examine the urethral meatus. That is very important. Genital infection, genital examination is important. I must check. The doctor should check by retracting the prepuce and urethral examination of the urethral meatus for the phimosis, then meatal stricture or meatal inflammation, and also urethral discharge for gonococcal infection. Patient has already told me, but doctor should confirm by his own eyes and by own inspection and palpation method. Okay, let us move further. Then, as the patient is having above 40, doctor should try to do the per rectal examination. With the sterile procedure and sterile hand gloves, the doctor should try to ask the patient to lie down on the left lateral position. Left lateral position is required for the PR examination, per rectal examination. By doing the per rectal examination, doctor can palpate. If the doctor by chance palpate the prostate or the prostatic enlargement, then that can be the case of benign prostatic hypertrophy. And I also check for the tenderness. When I start PR and if the patient is screaming, doctor, please, that can indicate the prostatitis, inflammation of the prostate gland. So UTI, urinary tract infection, can be secondary to the enlarged prostate. Remember this point. So each and every senior citizen, 40-up patient with burning micturition, I must be able to rule out the possibility of prostate gland. Okay. Okay. Then if there is only frequency, no burning, burning is not there. Try to understand, burning is not. By chance, this is the case another, but I am discussing many possibilities. If there is only increased frequency of urination, then the doctor must think of diabetes mellitus. Doctor must think of tuberculosis of the bladder. Doctor must think of the bladder neck prostatic hypertrophy. Okay, so all these possibilities should come into the mind whenever the patient is senior citizen, 40-up patient. Now, in short, what are the important points in this particular case? Number one, that is how is the urinary flow. Number two, doctor should think of bladder stone, calculus, distended bladder, meatal stenosis, then a palpable stricture or the stone, then the prostatic enlargement, prostatitis by PR examination. All these points are very important, key points in this particular case. Now, what I should do? I can ask for the urine routine examination. The pathological report will become and physical examination, chemical examination, and microscopic examination. So there may be report of the urine albumin, urine sugar, urine bile salt, bile pigment, ketone bodies. The most important in this case, what I am expecting is the pus cells. There must be 30 to 40 per high power fluid pus cells. That is a moderate type of the infection. Then the doctor should treat the urinary tract infection by prescribing the very important antibiotic, that is norfloxacin. Norfloxacin is the best antibiotic for urinary tract. Then as the urinary infection always makes the urine more acidic, the doctor should try to make the urine little bit alkaline by giving cital syrup. 1 spoon with the glass of water, or tablet pyridium is very useful. 1 tablet morning and evening. That will definitely relieve the burning micturition. It will soothing lubrication of the urethra will take place with tablet pyridium. Norflox, cital, pyridium. Norflox, cital, pyridium is the management. Also, ask the patient to drink a lot of water and the fluids. If there is by chance no relief, then doctor should proceed for the urine culture and sensitivity. Very important examination. X-ray for KUB, kidney, ureter and the bladder. That must be done. Also, sometimes sonography and the cystoscopy can be expected when there is no relief in the expected due course of time. My dear friend, but this is a case of definitely urinary tract infection. So if you want to understand such type of the different problems in general practice, please, I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel to boost the energy of Dr. Deshpande. I wish all the best, take care, and see you in the next video.